My name is Stephanie Jones, and I am studying at Anderson University, and today I will be talking about the mental disorder schizophrenia. The overview is I will be going over the historical background, diagnosis, etiology, treatment, prognosis, biblical perspective, interviewed questions, and I will show the references. For the historical background, our knowledge of schizophrenia and its complexity has grown and developed since it was first acknowledged as a mental illness. Even before using the term schizophrenia, there are descriptions about it that can be traced back centuries, and there are some historical instances that describe individuals expressing symptoms that align with schizophrenia, such as hallucinations, delusions, and disorganized thoughts. The actual definition of schizophrenia came around in the late 19th and early 20th century, and there was work on differentiating it from the other mental diagnoses, from Emil Kraepelin's work on dementia praecox and its progressive deterioration. The term schizophrenia was later created by Eugene Bleuler, who focused on the psychic functions splitting. The DSM-5 and the evolution of diagnostic criteria are continuously growing because researchers are gaining new understanding and ongoing refinements of the disorder. The early treatments were often basic and were limited to the effectiveness of them, but when antipsychotic medications were developed, it became a turning point, although there were still some continued challenges in finding the best treatment and effectiveness when it came to managing side effects. As research continues, it struggles to uncover the intense relationship of genetic, environmental, and neurobiological factors that play a contributing role to the disorder. The DSM-5 diagnosis for schizophrenia has to show at least two of these symptoms. 1. A time period of 1 month of delusions, hallucinations, disorganized speech, disorganized or abnormal motor behavior, and negative symptoms. 2. There must also be an obvious dysfunction in their social or occupational lives for a substantial period of time. 3. There cannot be another medical condition or substance use affecting the individual showing these symptoms. It is important to rule out other mental illnesses that show the same or similar symptoms as schizophrenia. The process for diagnosing an individual includes clinical interviews, psychological assessments, and neuroimaging. The DSM-5 criteria are geared towards expressing clarity and consistency when it comes to diagnosis, though there are some challenges in identifying smaller symptoms and identifying schizophrenia as opposed to other psychotic disorders that are similar. Schizophrenia's etiology, a combination of environmental factors and genetic predisposition. Schizophrenia's etiology is complex and multifaceted, and it includes a complicated combination of environmental factors and genetic predisposition. Genetic studies have discovered that multiple different genes can increase susceptibility, but no specific gene causes the actual disorder. The environmental factors can also play a role in the disorder, such as early childhood trauma, prenatal exposure to infections, and obstetrical complications. And according to Van Os et al. And Brody, being raised in an urban lifestyle can also have an impact on the development of schizophrenia. There are also changes in neurobiology that include disturbances in the structure of the brain and its function, which include altered dopamine, neurotransmission, neurodevelopmental abnormalities, and glutamate dysfunction. When these interact with genetic susceptibility and environmental triggers, it is very likely that it contributes to the development of the disorder, which has been discovered by Brody and Van Os et al. It has been emphasized that by researchers that the neurodevelopmental perspective is greatly related to the development of the disorder. For treatment, the treatment options for schizophrenia usually involve a mix of psychosocial and pharmacological interventions. Research has also found that antipsychotic medications are the best pharmacological treatment, which focus on targeting dopamine receptors while also reducing positive symptoms such as delusions and hallucinations. But Borelli and Soleri and Crawford and Go have assessed that these medications need to have management and monitoring because they can have significant side effects. Some beneficial treatment options that are psychosocial include family therapy, cognitive behavioral therapy or CBT, and social skills training to help improve social functioning, the reduction of stress, and enhance coping skills. There is also another form of therapy called music therapy, but this is still being researched. It is important for the interventions to be applied as early as possible to reduce the long-term impact of schizophrenia. When going through treatment, it is important to keep a collaborative relationship between the physician, patient, and any other healthcare professionals. Research continues to grow and develop more beneficial and comprehensive medical and psychosocial interventions. For the prognosis for schizophrenia, it really depends on multiple factors. For example, adherence to treatment, access to treatment, symptom severity, premorbid functioning, and age of onset. Borelli and Soleri and Goldman et al. Discuss how certain individuals may go through full or partial remission, and there are others who may experience symptoms that are persistent with significant functional impairments. The earlier the intervention and access to beneficial treatment have been related to improved results and states. Another option is long-term management, which includes continuous medication, clinical monitoring on a regular basis, and psychosocial support. For the biblical perspective, while schizophrenia is not mentioned directly in the Bible as the modern-day diagnosis, it does give passages that guides us to comfort those who are faced with mental health challenges. First, we're going to talk about Isaiah 41:10, and it reads, "So do not fear, for I am with you. Do not be dismayed, for I am your God. I will strengthen you and help you. I will uphold you with my righteous right hand." This verse can be applied in many situations, but in this case, it is relevant for individuals who face adversity, including a mental illness such as schizophrenia. Next is Philippians 4:6-7. It says, "Do not be anxious about anything, but in every situation, by prayer and petition with thanksgiving, present your requests to God, and the peace of God, which transcends all understanding, will guard your hearts and your minds in Christ Jesus." These verses show God's presence and grace with those who call upon His name. He gives comfort, and it shows that He is in control in every situation. Throughout the Bible, it also shows how important it is to have a community of support that embodies Christ. Next, I will be reading off 3 questions that I asked Kathy Brock. The first question is, are there any specific risk factors or causes when it comes to schizophrenia, and what are some of the challenges in making an accurate diagnosis? She answered, if someone in the immediate family has males, then they're at a higher risk, and drug use can make it very hard to diagnose due to the same symptoms. And the DSM-5-TR is used to diagnose, and you must have 2 significant symptoms, for example, delusions, hallucinations, disordered speech, and catatonia, and the symptoms must last at least 6 months. Question 2. How can family and friends support someone with schizophrenia? She responded, family support is very important due to when patients start taking medications to treat schizophrenia, they start to feel normal, and then they feel that they don't want to take the medication anymore, so they stop taking them, and the symptoms return and can become even worse. So having the support of family or friends to encourage the continuous taking of the medication or attending therapy is really important towards that individual's health and the returning of symptoms. The third question is, how does brain imaging help in understanding schizophrenia? The CT or MRI exam only rules out brain issues that could cause the symptoms instead. Blood and urine tests are only used to rule out drug use, and brain imaging in someone with schizophrenia would be beneficial to see what areas of the brain are firing at specific times and in specific situations or with different stimuli. It would help to see if there are any areas that should be reacting that are not. And here is a list of references that I used to help with my research, and the people that I talked to, and everything that was talked about in this video. Thank you so much. That's everything.